Hello and welcome to Behind the Lines. I'm Diane Dayton. Today we're going to talk about wellness, being healthy, and to do that we have Dr. Ann Lee. Thanks for being with us.
Thank you for having me.
Now you are a naturopathic doctor and you're also a licensed acupuncturist. Tell us about naturopathic.
So naturopathic medicine is basically using natural modalities and therapies. I think some terms that people know these days are, herbs and homeopathy, using nutrition, supplements, things like that to really help optimize our health.
Okay, so what you're really looking at, I think the basis to this is looking at what we call the whole person.
Yes, so we look at, every aspect of a person, mental, emotional, spiritual, your work-life balance, family balance, everything like that.
It's all related.
Mm-hmm.
We talk about stress taking its toll. Well, that's a part of it too, isn't it?
Yes, a lot of what I do every day with patients is working on stress management techniques and tools that people can use to cope with all the stress that we have in our society and lifestyle today.
Where's your office? Where are you
My
located?
office is right off of Columbia Avenue in Lancaster. It's very close to the shopping mall, Stowmill Plaza.
Okay. Now, there's a lot of background and a lot of education that goes into doing what you do.
Mm-hmm.
What do you have?
So to get into naturopathic medicine school, you need to have a 4-year undergraduate degree. I fortunately got mine in chemical engineering, so I was able to get all the prerequisites in. I only had to, take biology classes during the evening time when I was getting ready to go to naturopathic school. So 4 years of undergrad, and then naturopathic medicine is 4 years, and acupuncture is a 3-year program. So 11 years total.
11 years total. Okay, so you've done your homework. And you've been in the Lancaster area, the past 2 years?
Past 2 years.
Okay. Acupuncture. Help those of us who don't really understand what it is. Tell us about it.
So acupuncture is basically stimulating certain points in the bodies with needles, and the needles are, very small. They range from a half an inch to 5 inches, usually more on the, lesser side. And their thickness, they tend to range from 0.16 millimeters to maybe 0.5 millimeters. And, those are used to stimulate points, and they either work on increasing blood and circulation to certain areas of your body. And that can help with pain relief, promoting healing over time. And then for other things such as digestive issues or hormones, they work on increasing circulation to organs in your body, and they help to function better.
How old is acupuncture?
Oh, it's many, many, many years old. It originated in China, so it's a, very old medicine, thousands and thousands of years.
And I think it's becoming a little bit more mainstream in this country. It's taken a while.
Yes.
But it really is. It almost is like people will go to this after everything else has not worked for them.
Exactly. It's kind of a last resort.
Whereas, I guess in some societies outside of ours, it's just a part of how we are treated, correct?
Mm-hmm. It's part of the healthcare system in some countries.
Okay. Now, when we look at this, we look at treating the whole person. How do you go about, if someone comes in to see you, what would we expect?
So the first thing when people come to see me is I have them fill out a very detailed intake. And the intake goes through, what are you eating, your meals, any emotional stuff going on, any traumas in the past. So it's very detailed, and then when I come see them in the office, I'm questioning them, trying to find out more information and figure out, I'm kind of putting all the pieces of the puzzle together to figure out which aspect of their lives is really important and affecting their health the most.
Okay. So it gives you essentially the whole picture.
Yes. Mm-hmm.
So what you do is you look at the best of modern science as well, Western medicine as it were, and then also other traditional natural medicine.
Mm-hmm. So I do definitely, when people come in with lab work or imaging, I also take a look at it. Even though I'm not as much of an expert, it's additional information that can help put the pieces together.
Okay. So what has it been like, to be doing this and seeing results with people?
It's every day it's so rewarding because then you can see the long-term effects that it has with people when they're functioning, have vitality and energy, they're, pursuing their passions, they have better relationships. So, the effects are so widespread.
I bet you see people for a lot of different reasons, don't you?
Mm-hmm.
Give us some idea of some of those reasons why we would come to see you.
So the most popular thing that I see people for is pain because that's in the mainstream what people most think of for acupuncture. But definitely, anything stress management, anxiety, depression, hormone balancing. So a lot of, all the female hormone conditions that come across. And, definitely I see kids too, so it varies widely.
Yeah, it's right across the board.
Mm-hmm.
Yeah.
And usually when people come see me, like you said, they've gone through all the doctors and the specialists, and either, all the lab testing comes up normal, but they still have symptoms, or they come to the point where they've gone through all the conventional therapies and there's nothing else left to offer them during the conventional route. Okay. So then they start looking at natural and alternative ways.
So you uncover sometimes what some of these mysteries may be.
Mm-hmm, mm-hmm.
And you look behind the scenes, essentially.
Yes. And a lot of times it can really just be lifestyle things that happen. Stress is very amazing at how it can affect the body in different ways and for different people.
It sure does. Now you have a website. What is that?
My website is www.drnaturalmedicine.com, and it's all spelled out, so it's DOCTOR, naturalmedicine.com.
You have a very informative website. What are we going to find there?
So what you can find on the website is most of the frequently asked questions. People ask about, insurance, coverage, what's it all involved in the visits, different things that I can help people with. And there's even some videos that are helpful for people to watch.
Okay, so it's a great place to start if you're curious.
Mm-hmm.
Well, what we're going to do, we're going to take a brief pause, and we come back, we're going to talk to one of Dr. Lee's patients about pain and what help she's gotten from her. Stay with us. Welcome back to Behind the Lines. We're talking about being healthy, wellness, and joining Dr. Ann Lee, who's a naturopathic doctor and also licensed acupuncturist, is a patient of hers. We have Connie Chamberlain, and thanks for being with us, Connie.
You're welcome.
And right now you're not in pain, right?
No.
And thanks to Dr. Lee, right?
Thanks, yes.
Tell us your story. What happened?
I had an injury to my head about 9 years ago, and the pain has been constant for 9 years. And when I lay back on it, it is when it hurts, only on the left side. But I went to the doctors for scans and diagnostic, and nothing was showing. And I did all the things that they told me and recommended, from the shots of cortisone and all these different trigger point injections, chiropractics. I did everything you can think of to help myself, and drugs for pain, and I didn't want to do any of those things. But as a last resort, pain management in a major hospital suggested, why don't you try acupuncture? I really wish I would have done that first, and I would have saved a lot of aggravation and got results, I believe, because after maybe half a dozen visits or so with Dr. Lee, I felt major, I was pain-free in this one segment of my head. I'm still shocked.
Well, here's what's interesting. You said you dealt with this pain how long?
9 years.
9 years of going through what we would probably call traditional routes, and good routes, to check. But coming over to see Dr. Lee and starting to get acupuncture, how quickly did it start to dissipate?
Well, around my 6th or so appointment, I was at home and I said to my husband, I don't know, I shouldn't say anything because maybe I'll jinx it, but I don't feel pain. And I couldn't wait to get back that week and tell her. And it stayed away. I can't make it come back. I mean, it's gone. Now it's just focused down the center in the neck area, but we're still working on that.
Okay. Tell us a little bit about Connie's case and what's working for her.
Well, when she first came, I wasn't really sure how it was going to go, too, because like you said, she was dealing with it for 9 years, and she had also tried all of, many natural therapies, too, like chiropractic, which normally would, benefit and work. So it was a little bit of, experimentation for me. But, being very consistent with the acupuncture, focusing it on that particular area, I was able to, make headway. So I was very happy with that.
Right. Well, I guess usually by the time they get to you, you have so much information on what worked a little bit or what didn't work at all that it helps you uncover.
It does, because every, piece of information, it's telling me, where is the best direction to go.
How did you feel when you first went to her, Connie?
Well, I'm a needle phobe.
Okay.
So, you have to think about that. But you don't feel these points. It's not like, it was no problem whatsoever. And it's just like, people should think about going to acupuncture first because it's cost effective, it's harmless, non-invasive, going more mainstream. And there's really nothing to lose. So,
except pain.
Well, exactly.
Lose the pain.
Exactly.
Lose the pain. So when you look at Connie's situation, you see a lot of people that come in to see you very similarly, right?
Definitely. A lot of people who've gone through the conventional route and they don't know where else to turn.
Yeah. What would you say to someone who's watching that may have some pain and they're just at wit's end?
Be your own advocate. Don't wait for that one doctor out there that might suggest like I did. Just look it up. You don't need a prescription. You don't need a doctor. You don't need anyone to tell you to go. And just stick with it. It might not happen overnight. And with me, I always feel relief even after a massage the night after, the day after. So stick with it. And, she told me right off the bat, it's 50-50. And I was like, I stuck with it and I'm happy.
So you've had acupuncture. Have you had other changes as far as your treatment goes? Anything else that you've changed?
Well, like I said, I try to look at everything, nutrition and digestion. So we have been working on Connie's digestive system and also building up her immune system as well.
You get depressed when you think about being told you have to live with the pain, and there's not much we can do, and you can be on drugs if you want forever, and you kind of get it in your head that this is what I'm going to deal with the rest of my life, and you kind of it gets depressing, and then you go to her and she's like, we can probably help you, and she's so calm and helpful, and you can tell her anything, and she's helping with everything. So
you had never tried anything outside of what we would call modern Western medicine. Have you really tried anything different, or
I guess chiropractic would be more
the closest thing to
massage, and stuff like that.
So when you went to do this, it was outside of what you typically would have done.
Oh yeah, and she does give you homework. She gives you things that you can do to yourself. On like pressure points maybe on your, like for me, my neck would be my nose area. And she wants feedback from you as you're getting the acupuncture, because if you don't, most doctors don't want that, but she wants feedback and she wants to know what's working and what's not, so she can pinpoint where to go with it.
It sounds like a partnership in your well-being.
You are a partner, and they want you to talk and they want you to tell you feedback, which is so relieving.
Well, you need to be your own advocate too. And I suppose you really feel like you've been heard by Dr. Lee too.
Exactly.
Yeah, that's good. So when we look at this whole picture with Connie, this has to make you feel wonderful to be a part of her progression back to health.
Oh, definitely. It's great to just feel like a support system for people that I'm helping.
Okay. Any final comments from you, Connie, that you want us to know about your experience with the relief of pain?
Oh, I'm a huge advocate of acupuncture now, because this has helped, and I've done it with my dogs before, so I knew it worked. And then when it came to this, I should have done it years ago, but I was just doing what the doctors told me all along, the specialist, and to do this, take that, take this drug, and it's really against my belief to be on a drug if you don't know the cause of your pain.
Sure.
Why pretend like it's not there, erase it, get to the root of it.
So I think the biggest change was that you started taking control of your health. Exactly. And went outside of maybe the box, as we would say, at least as we traditionally know it in this country, and tried something different for good results.
Exactly.
I'm happy for you. That's wonderful. Glad to see you're not in pain.
Thank you.
Good job, Dr. Lee. When we return, we're going to talk to another patient of Dr. Lee's, and we're going to find out how acupuncture can help. Stay with us. Welcome back to Behind the Lines. We're talking about wellness, being healthy, naturally, too. And joining Dr. Lee and I, Jessica Kelly, you are a PhD, you are a college professor of geography. Thanks for being with us.
Thanks for having me.
Now, one of the areas that you address is fertility issues. Who would have thought, right? But doing it very well, in fact, and I think that's what Jessica's story is about. So tell us your story.
Well, I actually had some trouble with fertility starting when I was about 26 years old, and my husband and I had tried naturally for over a year, and we were not successful. And so we turned to the traditional paths for infertility treatments, and we went through over a year of therapy using pharmaceuticals. And we were successful. I have a 2.5-year-old son now, and I absolutely adore him. And so when we decided that we wanted to have a second, we thought that our probable options were going back to the pharmaceuticals again. For about a year, we tried to conceive naturally. We were unsuccessful again, and I was very hesitant to go back to the pharmaceutical treatments.
They're costly.
They're extremely costly, and they're extremely difficult on the body, emotionally, and when there's a failed cycle. I think a lot of expectation is built up through that process because you want so badly for it to work. And so when it doesn't work, it's extremely devastating. It's difficult to re-engage with the next cycle. With my first son, and we went through 4 failed cycles before we were successful. So I was hesitant to return to that model, especially having an active toddler. And so I had a friend who was successful with acupuncture and her infertility treatments, and so she had referred me. So I started with Dr. Lee, and I felt a lot healthier just in general. It went without a lot of expectations.
Okay.
I think I went believing that, well, we'll give this a try. It's probably not going to work because we had unexplained infertility. Everything was functioning normally from what the doctors had told us. So there really was no reason why we weren't getting pregnant. And so I think I went in thinking, well, at least I'll feel a little better. I'll be a little bit more relaxed. I'll relieve some of my stress. And if we get pregnant, then great. That's just a wonderful benefit to this. We were successful after 2 months.
Oh, wow. 2 months.
That's right.
And you're pregnant.
I
now.
am. Yes. Almost 4 months along.
Congratulations.
Thank you.
What do you have to say about Jessica's case? If there was no apparent reason, how did acupuncture and what you offered work for her?
I think the biggest aspect of unexplained infertility is definitely stress management, lifestyle, and diet. So Jessica was, going through a stressful time, trying to get tenure. And so I really worked with her with the acupuncture on just relieving the tension and, helping her figure out ways to cope. And also we worked a little bit on the diet aspect of it too.
Well, what you talked about are all areas that all of us need to be concerned with. Stress, especially with the way society is now, it just seems to be more so. Diet, exercise. It seems like something we should be doing without even questioning, just definitely each incorporating. More thoughts on that, Jessica?
I think that's absolutely true. I am not great at maintaining a healthy diet, especially under times of great stress. And it's not so much that I'm choosing wrong foods as much as I just need to be choosing a more balanced diet in general, more fruits and vegetables, less processed foods, things like that, incorporating more exercise, but not just exercise, but exercise that was helping to relieve the stress, so being very mindful about those choices too.
So you had never done acupuncture before?
I had never done it.
How was it the first time?
Honestly, I was terrified. It was probably a big reason why I'd never done it before. I was very worried about someone putting needles in my face, and I don't have a strong anxiety about needles in general, but there was something about a needle going into my face. And honestly, when I was actually in treatment, Dr. Lee put me at great ease. I felt very comfortable, and I didn't even feel them, to be honest, so it was great.
Just what Connie said, too. You didn't really feel it. Now let's talk about how you've helped a lot of different people with a lot of different types of illnesses. Insurance, how does that work? I know people are probably wondering.
Yes, and insurance policies are changing all the time, but really I am getting a lot of patients who have flexible spending accounts or health savings accounts that can definitely be used towards acupuncture. But really the best thing is to call your insurance company and see what their current coverage is.
Well, we know things are changing and our society is becoming more open and looking at ways for preventative medicines and therapies. And I think this would definitely fall into that. So I have great hopes that eventually that will cover even more too. What would you say, Jessica, to somebody who's watching and may have, I don't know, pain or a fertility issue?
I think you have nothing to lose. I think for me the position was if I'm going through fertility treatments in the conventional manner, then I had a lot to lose, right? It was pretty harmful to me just on a day-to-day basis in terms of how I was feeling, because it was changing my chemical balance, and my emotional state was quite different. And I think with acupuncture, even if you're not successful, you're at least healthier. And for me, that was a good way to approach it, to say, well, maybe I won't become pregnant, but I know that I'll be healthier leaving this. I won't be worse off than when I started it.
And that's a good place to be, healthier. And we all want to be healthier. I want to reiterate, too, that we talked about you incorporate modern science as well as naturopathic therapies, natural. So we're not talking one way or the other, but we're talking about treating the whole person.
Yes, definitely. So when Jessica came in, I looked at all of her fertility workups to see, make sure I covered all the aspects of it.
What do you want us to know as a final thought about what you do and the therapies and how they can help us?
I guess to be your own advocate, and the internet has a lot of resources out there now, so to do the research, see what options you have out there, and to really go and pursue them.
We're going to put your website up on the screen in case anybody wants to find out more about you, what you have to offer, videos and information. Final thought from you, Jessica.
Give it a try. Acupuncture really changed my life. We're very excited about it, and I'm happy to be an advocate for it.
And congratulations on being pregnant.
Thank you very much.
That's wonderful. The changes that you have made in the two people here, their lives, has been wonderful. Thank you so much for sharing with us the information about what you do with naturopathic and also acupuncture. Don't be afraid, right?
That's right, don't be afraid.
Thanks so much for being with us today. Thank you for joining us today, too. And we'd like to thank Flowers by Paulette for the beautiful flowers on our set. I'm Diane Dayton with Behind the Lines, and remember, keep looking behind the lines. You might be surprised what you find.